Okay, this is the home visit curriculum at St. Agnes Hospital. It's also a study that we are doing. I'm going to make this efficient for you. You are watching this video because you missed the presentation because you were probably on nights or something like that. So thanks for watching this video. Let's see. Okay, so the objectives of this curriculum, of this presentation, are to learn the benefits of home visits for patients and families, learn the benefits of home visits for doctors, you guys, and doctors in general, review the logistics and plan for the home visit curriculum at St. Agnes, and we'll talk a little bit about the social determinants of health, specifically in Maryland and Baltimore. Let's see, I feel like, oh, we missed this. So what I want you to do now is I want you to imagine your home during childhood. Think about your family, the physical way your home looked, your neighbors, your neighborhood. Just kind of picture that. Okay. Now I want you to imagine one of the homes of a patient you recently cared for who lives in Baltimore City. So try and picture their home, their family, how their home looked, their neighbors, their neighborhood, how they get to school. Okay. And is there a difference between your home and theirs? And if so, what are those differences? And if there are differences, how do you think those differences contribute to that child's health? Okay, so these are rhetorical questions. Just think about that for a minute. And that's kind of it will lead us into our home visit curriculum. So, a little bit of background. Doctors used to do home visits a lot back in the day, but not doctors don't do them much anymore at all. Social workers can visit the homes sometimes, and some nurses nursing at home, but doctors just don't go out to the homes anymore. Some of you may have done home visits in the past, but it's not a thing that is is as common as it was. And time and reimbursement have been probably the major reasons why. What are the benefits of home visits? Well, they emphasize the humanistic aspects of medicine. That perhaps there's longer time periods with their patients on their turf, kind of more relaxed. You will likely gain a more complete picture of the child's environment and social support network, and it hopefully will allow more confidence of the family in their doctor. There's some other there's some other benefits to home visits. The the number one reason why we started this curriculum is so that doctors can learn how the social determinants of health affect our patients and see that firsthand. So let's talk about the logistics of the curriculum and the study. So first, let me take a step back and say that this is a study that we're doing to see if see the impact of the home visits and if there is an impact. Um, Residents, you you do not have to be involved in this curriculum or this study. You can choose to do neither. You can choose to just do the curriculum, but if you don't kind of want to be in the study and answer questions, that's fine. And of course, families also don't have to participate if they don't want to. Um, if at any moment during the curriculum or the study you don't want to do it, that's totally okay too. Um, and we will need to get your written consent for you to participate in the study and answer questions afterwards. So just ask one of the attendings. Well, let's talk about the logistics of the curriculum and study. So each intern will choose two patients during the rotation to conduct a home visit. We need to get permission from the family. before, ideally, maybe on the day of discharge or during the hospitalization. So keep that in mind. If there are families you want to visit them in their home, keep that in mind. Um, okay, so we'll choose two patients. Now, ideally, let me back up. We want to try and get some patients that are non-English speakers, perhaps Spanish-speaking patients and perhaps Burmese-speaking patients. There's a large Burmese-speaking population near St. Agnes, and we'll try and get interpreters to go with you. So plan to conduct the home visit a couple of days after discharge, maybe 1 to 2 days of discharge. Schedule the visit with the family while they're still here, if possible. On the day of the home visit, review the form, day of the home visit, and bring one additional resident, ideally a supervising resident. It doesn't have to be a supervising resident, but that might work well. So there should always be two residents going. You should never go alone, and perhaps an interpreter. And on the day of the home visit, review this form. I'm going to bring it up here. It will be available to you in the resident room. Before the visit, take a look at some of these important items. The home visit, here's some suggestions and things to think about questions to ask and way to go about it. Note that you don't have to ask the exact questions. There may be interesting conversations that arise from these or other questions, and it should be what kind of the family wants or needs. And then we want you to just reflect afterwards, perhaps on the car ride home with your other resident, some of these questions. Okay, so that's the day of the home visit form. I'm going to go back to the PowerPoint. Okay. Visit the home. It should take maybe an hour or so, maybe a little less. Have the reflection session. Refer to the day of the home visit form. We want you to report out to the team what was learned before rounds the following day. So maybe 5 minutes how the visit went and what you learned the following day before rounds. And we want to have a whole team reflection session about what was learned and what you guys thought about the curriculum and study. Okay, so components of the home visit. There could be different things, different perspectives that one might want to uh, think about when visiting the home. It could be just following up the hospitalization. How did that go? It could be observing the child's environment for safety, um, or just the child's environment around the family, the neighborhood. Learning about the child's caregivers and family, understanding the family and social dynamics, assessing home safety is a whole nother kind of topic. Is the home safe for the child, physically safe, and perhaps psychosocially safe? And then we also want to ensure your safety too, and we'll talk a little bit about that. We're going to focus mostly on learning the social determinants of health. So not really following up the hospitalization or assessing home safety. Of course, if these things come up, that's fine. If that's what the family wants to talk about or do, that's totally fine. But we want you to gain a picture of this child's world, where they go to school, where does the family get food, where does the child play, um, those types of things. And the day of the home visit form will help frame some of that. So observing the environment. While you're driving to the home, take a look around the neighborhood. What does the neighborhood look like? What stores are there? What people are walking around the neighborhood? Where is there a place to play? Where's the school en route to school? Family and social dynamics. Who else lives in the home? Who else takes care of the child? Home safety, all these kind of things that you guys probably know to ask about. Your safety. So, safety first. Find where the home is on Google Maps. Make sure that it's an actual address. Go to Google Street Views and take a look at the house. If at any point you just don't feel safe or you don't feel comfortable, then you can stop. If you're walking to the house and you're like, nah, I just don't have a good vibe, then you can stop. Um, residents have been doing home visits for years and years at Hopkins, and it's been very safe. But if it doesn't feel right, then don't do it. Um, let's see. Okay, challenging situation. So things might come up occasionally where you feel the child is sick or there's a CPS issue. Obviously don't bring it up right in the house, but come we can talk about it with the attending, unless you feel comfortable bringing up something like you don't think the child's breathing too well or something like that. So you use your practical um, practical skills, and what you think is the practical thing to do. But you can always talk to one of the attendings back in the car or on the ride home to see what we can do in the best interest of the child and also for you. Okay, let's talk a little bit about the social determinants of health. Um, I'm going to read this quote kind of touching on that a little bit. So, the social determinants of health are shaped by the distribution of money, power, and resources, which are influenced by policy choices. The social determinants of health are mostly responsible for health inequities. So, some examples of social determinants of health are, where you live, what neighborhood do you live in, um, where where do you get food from a practical point of view. Um, it's what what's the color of your skin. What house do you live in? So hopefully you'll start to um, kind of think more about this. But let's take a look at some data. So this is Maryland. Okay, this is the state of Maryland. This is Western Maryland. This is Southern Maryland. This is the Eastern Shore. And as you can see, where you live determines the low birth weight percentage. Baltimore City has a high low birth weight percentage, as does Dorchester County down here on the Eastern Shore, which is a fairly poor county, especially compared to Carroll County here or Howard County. Okay, let's look at children in poverty in Maryland in 2015. Baltimore City, 34% of children that live in Baltimore City their families are in poverty. Dorchester County is also kind of high. However, these counties in the center, not as high, but some in Western Maryland too. So where you live, it will influence whether or not you live in poverty. Let's look at Baltimore itself. This is Baltimore. These are the zip codes in Baltimore. Hopkins is about right here. St. Agnes is about right here. And this is life expectancy in years. So if you live up here in Baltimore, sort of Roland Park, life expectancy is higher. If you live here, central Baltimore, it's lower. So where you live determines how long you live. Low birth weight, again, depends on the zip code. St. Agnes is here. Neonatal mortality, families that live below the poverty level. Unemployment percentages. So these little purple dots are corner, grocery, or convenience stores, and the green dots are supermarkets. So there's clusters of um, either one in certain areas. This is this is vacant housing, but these little yellow dots are liquor stores. And we'll just end with this quote, and thanks for watching this video. Let us know if you have any questions.